let's face it, the bad and destructive habits, we've all got them. And that's the human condition, for all have sinned and fallen short of the glory of God. So we're in this boat together. This isn't just about the residents at the mission. This is about every one of us. And God's work in our lives is to redeem us, and that means to redeem us in all of who we are, both physically, spiritually, and mentally. And through the years, I've taken care of kids all the way from birth all the way up to people in their elder years. So birth to death. And I have had the opportunity of seeing the trajectory of people's lives over that period of time of several decades. And the thing that's disturbed me is to see people dying of preventable diseases, in particular those diseases that I've tried to help them to overcome. And the It's Our Lifestyle program is an idea or an attempt at a way of bringing God back into our understanding of our health. And my thought is that if we have a good theology of the Bible and a good theology of the body, and then we're more likely to be able to treat our bodies as God's holy temple.
A lot of people that are maybe a little adrift with their lives, things have been disrupted. They are not proactive necessarily with their health. They have other things to worry about sometimes. And so a lot of them may go to the urgent care or the emergency room for their medical care. So they'd be much better off establishing with a regular physician, being more proactive. And so we encourage them to get their regular physician, avoid disease and avoid problems rather than wait till they happen.
Some of the investigations that I was reading, the researchers were saying that somewhere between 40 and 60% of the activities that we engage in on any given day are driven by habit. And what I mean by habit is something that we do almost automatically without thinking. And then by nature, what that means is it doesn't take a lot of effort. For instance, most of us get up in the morning, we brush our teeth. And it doesn't take a lot of effort to brush our teeth. We almost don't think about it. It's just something that we do. And one of the keys of healthy living is to make as much as we can in the way that we do our lives into a habit, something that happens automatically, something that does not drain us of energy that can then be used in other areas. So my sense is that healthy habits are definitely something that we need to be working on, and there's certainly biblical precedence for that concept.
Part of improving the health of the community is more than just medical care. A lot of times it's the care that can't be written with a prescription pad. Inadequate or the wrong types of food, or no food. Housing, inadequate or not safe housing. And one that I was told by a doctor today, transportation over and over. We live in a very rural area. If you don't have a car, or if you're in a domestic violence situation where your partner takes the keys away, and you live in O'Brien or you live in Wolf Creek, you don't really care about getting your prenatal care, right? Or you don't care if you don't have the right type of food, or you're homeless and you're trying to find a safe place to lay your head at night. You're not going to care about your diabetes. You're not going to care about taking your blood sugar to see if it's high or low. So until we as a society start to deal with those social determinants of health, the medical costs will keep rising, and you're not getting people better. And that's why we really embrace programs like the Gospel Rescue Mission provide.
In Christ's ministry, he spent more time healing than he did preaching or teaching. As the Bible describes it, he went around healing everyone and went through towns and healed everyone who's had any diseases. So his emphasis seemed to be that you meet the needs, the real physical needs, and the diseases, and then people are ready to listen to the next level, next higher level, which is the spiritual aspect of things. They're willing to listen because they know you care. They're ready to listen because they don't have something else nagging at them that distracts them.